Hello everyone. In this video, we shall see what is screw-in effect while doing root canal treatment and what are all the techniques by which we can minimize or prevent screw-in effect while doing cleaning and shaping. Have you ever experienced this? When we are doing cleaning and shaping, without our intention, the file gets screwed inside the root canal and probably it goes beyond the apex. Yes, this unintentional extrusion of the file or the file going beyond the apex or getting sucked inside the root canal by the file getting binded or screwed inside the root canal, and probably this goes beyond the apex and that could cause postoperative pain and violating the apical foramen. In this presentation, we are going to see and analyze about what are the reasons and how to minimize and how to prevent screw-in effect. By the way, I am Dr. Benin Palayan, and if you are interested in my videos, kindly subscribe to my YouTube channel, Smart Dentistry. And if you are a beginner starting with a rubber dam application in your clinical practice, I will put a link in the description. Kindly enroll for my course in Udemy on rubber dam in clinical practice. Let's see in detail why this screw-in happens while doing cleaning and shaping and how to prevent it while doing cleaning and shaping. There are two factors we have to consider. One, the factors which are in the hands of the manufacturer of the file, and then the factors which can be influenced by the dental practitioner. First, let's see about what are the factors which are controlled by the file selection or which are controlled by the manufacturer. First, choosing a file with non-cutting tip will minimize screw-in effect inside the root canal system. In this picture, you can see the tip of the file which is sharp. This is called as a cutting tip or an active tip. And in the second picture, we can see the tip of the file which is inactive, passive or non-cutting. The active cutting tips always tend to screw inside the root canal, and when we are doing cleaning and shaping, it gets binded and it may pull the file inside the root canal system. So it is always better to use a file with a non-cutting tip. Most files which are used for cleaning and shaping in endodontics come with a non-cutting tip. But it is a habit for some people to use the retreatment files for cleaning and shaping. Retreatment files always come with a cutting tip. So it is better to avoid any retreatment file for cleaning and shaping or regular canal preparation. Retreatment files should be used only for the removal of gutta percha from the root canal system and not for cleaning and shaping of the root canal system. So, any file which has an active cutting tip or a sharp tip should be avoided. All rotary files which comes with a passive tip or non-cutting tip should be used for cleaning and shaping. That will minimize and prevent the screw-in effect. Second, it is wise to use files having a progressive taper. Let's understand what is this, and I made this picture just to make everyone to understand what is the blade or the flute and what is the core. You can see in this picture the sharp points or the cutting portions or the flutes of the file, and the central part, the metallic part, is the core of the file. And we can see, let's simplify this and let's keep this is the core of the file, and we can see a second image where the core is not uniform. In some places it is wide enough and some places it is narrow. This is called progressive taper. So what happens is, while doing cleaning and shaping, if you are inserting both of these files, in the first scenario the file gets closely adapted to the canal, and that has a more tendency for screw inside the root canal. But in the second picture we can see that the file is not getting adapted well. So there are areas where the file do not come in contact with the root canal wall, where the debris will get accumulated, or the file will not make contact with the root canal wall. So as the files in some portions are not making contact with the root canal walls, the tendency for the file to screw in gets reduced. So it is always better to use a file which has an alternative taper or a progressive taper. The most common file system which is used, which is called the pro taper files, which is called as pro taper because of the progressive taper in the core. So if you ever feel the screw-in effect more often in your clinical practice, it is better to prefer to ProTaper files or any such files which have this type of progressive taper in their core. Next, it is better to choose a file with alternative cutting tip. So whenever a file has an alternative cutting tip, it has a less tendency for screw-in. We can see in this picture that I am drawing a line connecting the cutting portions of the file. But you can see that there are some flutes which are not coming in contact because some flutes are taller and some flutes are shorter. So when we are doing cleaning and shaping, this short flutes will not come in contact with the root canal wall, but the taller ones will come in contact with the root canal wall. So as the alternative flutes are of shorter and of longer dimensions, the shorter ones will prevent the file to thread inside or screw inside the root canal system. So this can also be used in order to prevent screw inside the root canal system. So the file called the race files, which is named called the reamer with alternative cutting edge. That's why it's called as race files. So this file has such an alternative blades which are shorter and longer. So this file have a tendency for minimizing the screw in inside the root canal system. The next feature that we have to take into consider is called the variable helical angle. In this picture, you can see the cutting flutes or the cutting blades are not of the same angulation. You can see that each flute is of different angulation. Just imagine a screw gets thread inside a wall because all the flutes are of the same angulation. So once the front or the smaller portions of the thread gets inside the wall, the bigger ones simply follow the pathway which was created by the smaller ones. But in this picture you can see that the flutes are of different angulation. So there is no constant symmetry is present. So once this symmetry is absent, the file will not get screwed inside the root canal system. So this is also a simplified technique, and we can choose the files. Many of the files which we commonly use, like the race files or the ProTaper files, come with a variable helical angle in the different portions of the canal. They do not have a constant one. So this prevents the screw-in effect of the file inside the root canal system. The last feature that you are going to see is the function of the control memory files. So the control memory files are the heat treated files, screw in less compared to that of the conventional austenitic files. For example, the files which come in golden color or blue in color, all are heat treated or control memory files. The conventional files, which are usually in the color of a stainless steel, the austenitic files, the ProTaper Universal, the K3 files, the iRace files, all these files are of austenitic files or the conventional types. So those files have a more tendency for screw in compared to that of the control memory files, because these control memory files are more flexible, and these flexible files have less tendency for screw in compared to that of the rigid files like the older, the austenitic forms. So it is better to choose a file which has a control memory type of the alloy. So in short, you may be thinking now, why can't we manufacture a file or choose a file which has a variable helical angle, which have a progressive taper, which have a passive cutting tip, and which have an alternative cutting edges? So what will happen if you are choosing a file with all these features incorporated? If all these files are incorporated, the tendency for the file to cut the root canal will get reduced drastically. So that's why maybe one or two of these factors are incorporated in each of these files. Not everything is incorporated in the same file. So there is not an ultimate file with all these features. So it is wise, and you have to understand the what type of file that you are using and what's the design of the file, and so how this file, whichever you are using, is going to prevent screw in inside the root canal system. But again, you may be using some specific file type for a longer duration, and which it may not be in your control. But what are the factors that are in your control in order to minimize the screw in effect while doing cleaning and shaping? Let's see one by one. The first and the foremost, or the effective technique, is called the segmental canal preparation. What is the segmental canal preparation? We can divide the root canal into three segments: the coronal 1/3, the middle third, and the apical third. We can use a file which has a greater taper, for example, a 8% taper file for preparing the coronal 1/3. In this file, we are not going to push deeper than the coronal 1/3. Just the coronal 1/3 we are enlarging with a deeper with a file which has a taper like 8% or 10% or something like that. Once that is prepared, next we can use a file which has a lesser taper like a 6% taper to prepare the middle 1/3. So what happens is, in the coronal portions which are already prepared by a taper greater like an 8%, now the middle third is going to be prepared only by the file in a small portion, because the coronal part are now not engaged in the file. So only a segment of the file comes in contact while doing cleaning and shaping. Once this is done, the apical portion or the apical third can be prepared by a 6% taper file, where again only a segment of the file will come in contact. For example, if you are using any file system which has a taper like 4%, 6%, 8% system, like a K3 system, like a Hero Shaper, and if you are using any such file system, you can follow this technique. So you will use a greater taper to prepare the coronal 1/3 and a lesser taper to prepare the middle 1/3 and a minimal taper to prepare the apical 1/3. Then if you want, you can enlarge with a greater taper file. Again, you can enlarge with a 6 taper after preparing the entire canal with a 4% taper. If you are doing the segmental canal preparation, the chances for the file to get binded will be reduced, and the chances for the screw in effect is very, very minimal. So instead of that, if you are using a 4% file to prepare the entire canal initially itself, the file will get screwed inside the root canal. In this picture, you can see that the file is making a contact only in the apical portion, not in the remaining area. So this file will not screw inside the root canal system. Hope this technique is very clear. And if you are experiencing the screw in effect frequently in your clinical practice, follow this technique. This is highly effective. Second is to choose an optimal speed. The files usually are recommended to be used in the range of 300 or 250 to 350. And for example, if you are keeping the file at a very high speed, and when we are doing cleaning and shaping, which is much more recommended by the manufacturer, the chances for the file to get screw in get increased. At a higher speed, all the files will screw in better or more than at a slower speed, because we are losing our control in the handpiece while we are increasing the speed. So keep the speed of the rotary file in the endomotor at an optimal. I do not recommend going to a speed more than 300 rotations per minute, but there are certain files which are recommended to be used at 500 or 600. In those situations, we have to keep the torque to be a very minimal level. And for example, if you are keeping a torque at 3 and if you are setting a speed at 600, then we can expect a higher screw-in effect with this higher speed. Second is the setting the optimal torque. Again, the torque we can set as per the manufacturer's recommendation. I do not recommend setting a torque anywhere more than 3. Setting a very lower torque, it is very difficult. It takes a lot of time because there will be a auto reverse frequently, but I recommend a torque of 3 for most of the file system. So do not set the torque to a very higher level, because once you set to a very higher level, the chances for the screw-in gets increased. And another effective technique for preventing screw-in inside the root canal system is using a brushing motion instead of a pecking motion. Let's see what is a pecking motion. So this is a pecking motion, just in and out motion, just pushing and pulling the motion. So you are using the rotary files to push the file inside, and you are going to remove the file outside. So this is called a pecking motion. Most of the files recommend a pecking motion. So whenever you are using a pecking motion, there is a chance that we may give excess pressure while pecking or pushing, and the file may go beyond the apex, or it may get screwed inside the root canal. So instead, you can use something called as a brushing motion. What is this brushing motion? So you are putting or pushing the file in one angle, and you are while removing the file, you will scrape it across any one of the wall, like mesial, distal, buccal or lingual, and you will remove the file. This is called as a brushing motion. The advantage of the brushing motion is it enlarges the coronal part of the canal wider, so that the file will not make in contact with the coronal portion, and the chances for screw inside are reduced. If you are taking a ProTaper system, the shaping files are supposed to be used in a brushing motion, and the finishing files are supposed to be used in a pecking motion. If you are using a shaping file in a pecking motion, it will get screwed in. So a common feature is, if you have ever experienced using SX for orifice enlargement, you will find that SX get pulled inside the root canal frequently. So the reason for that is you are not using in a brushing motion. SX, S1, S2, it all have to be used in a brushing stroke. And for that example, any orifice enlargement files, it is better to be used in a brushing stroke instead of a pecking motion. So finally, we can use reciprocation instead of rotation. So I have made this video in a very slow speed so that you can see that the file is rotating clockwise, counterclockwise, clockwise, counterclockwise in a repeated motion. So this is called a reciprocative motion. So the advantage of the reciprocating motion is it will not screw inside, because the file is not rotating in the same direction. It just rotates clockwise and counterclockwise, maybe at a degree of 30 to 60 degree, depending upon the type of the file that we are choosing. So this way the file will never get screwed inside the root canal. But the problem is the cutting efficiency with reciprocation is very less compared to that of rotation. So if you ever encounter a frequent screw-in of the file inside the root canal system, maybe for the initial preparation, maybe preparing the coronal 1/3 and the middle 1/3, you can use in reciprocation motion, because that will not screw inside the root canal. And once that is cleaned and shaped, then you can put your endomotor or the file in a continuous rotatory motion, and then you can prepare the remainder of the canal. I hope this technique is really helpful because with a reciprocative motion, no need to go the full length of the root canal. Just prepare the coronal and the middle third with a reciprocative motion. After the coronal and the middle third portion preparation with a reciprocative motion, then you can go for the apical third preparation in a rotary motion. So the easiest technique that could be followed are the coronal and middle third preparation with reciprocation, and also you can consider using a brushing motion. So choose a file which fits better for you, and again, before choosing a file, always make sure about the design. We always choose a file based on saying that how many times that it can be used, or what's the cost of the file, or whether it is a conventional file or a control memory file. But I would say that it is better to pay more attention about the design. What's the taper of the file? Whether it is a continuous taper or it's a progressive taper. What's the tip design? Whether it is an active tip or it is a passive tip. What metallurgy it is used for? Whether it is made of austenitic file or it is made up of a martensitic material. Or the helical angle. Whether the blades have land or no land, whether it has an alternative cutting tip or all the flutes are of the same level. So all these factors have to be taken into consideration. At the same time, we should also pay attention while doing cleaning and shaping. Use a brushing stroke or a reciprocative motion while preparing the coronal and the middle third. For the apical third, you can use a continuous rotary motion, or we can use a file with a minimal taper after enlarging the coronal and the middle third. Always set the file to optimal torque and the speed. So I hope that if you are following this technique, and if you have ever experienced screw in effect, these techniques and this understanding about the file selection will make it to better perform doing root canal treatment without causing much of the apical violation. Maybe probably one or twice, if it has happened, continue and master your technique. And if that is happening frequently, then you may have to consider changing the file type, or you may shift to a reciprocation file type of canal preparation for a few months, and then you can change on to, after getting a better hand and better understanding, you can move on. So I would always say that it is not a rough canal preparation with whatever the file which is available. Always understand the file design, and then you can make the field of the endodontics and make your patients super happy, because the file going beyond the apex is the most important cause for the apical violation and also for post-operative pain. Okay, I hope this presentation is useful for you, and thanks for watching till the end of this presentation. Have a nice day. I will come up with another video. Thank you.